Hello, everyone. I am Rahul Gosain,
And I'm Rohit Gosain.
and we are Oncology Brothers. AACR 2023 just got done last week, where we saw a lot of great data presented. But today, we wanted to focus on 3 studies that potentially could impact our practice in the community from this conference. We'll briefly discuss AEGEAN study for non-small cell lung cancer, Keynote 966 for cholangiocarcinoma, and then a SWOG S1512 for desmoplastic melanoma. Let us get started.
Oh, we are going to go over 3 different disease sites. That is what general medical oncology is all about.
Yeah.
We get to see a patient with lung cancer, then a breast cancer, and then following with cholangiocarcinoma. Exactly our practice. All right, let us dive into our first study. AEGEAN study, focusing on resectable non-small cell lung cancer patients, where the authors evaluated if addition of immunotherapy in perioperative setting adds any benefit. It is important to certainly talk about nivolumab Checkmate 816 study, which was in combination with chemotherapy and FDA approved in neoadjuvant setting, though. And this was again for resectable non-small cell lung cancer patient population, where we saw improvement in PAT-CR and event-free survival, though pending overall survival data. When looking at AEGEAN trial, total of 800 patients were enrolled with stage 2A to 3B. Surgery with either lobectomy, bilobectomy, or sleeve resection was planned upfront. Patients were then randomized to get neoadjuvant platinum-based chemotherapy in addition to perioperative use of durvalumab versus placebo. Neoadjuvant chemotherapy along with durvalumab was planned for a total of 3 cycles. Following that, patients underwent surgery, and after that, patients continued on either adjuvant durvalumab versus placebo every 4 weeks to complete total of 1 year of therapy.
Rohit, you brought up Checkmate 816 NIVO study. Again, it is important to appreciate the differences because in that study, there was no adjuvant arm. In my opinion, AEGEAN study confirms the role of neoadjuvant chemo-IO approach as we see improved PCR of 17% versus 4% in placebo arm. And then we also saw event-free survival in immunotherapy arm with a hazard ratio of 0.68. But how much is the adjuvant durvalumab for additional of 1 year adds is unknown. Another thing that we need to appreciate is that just shy of 1/4 of the selected patient population in the study did not make it to the surgery, and we need to better understand this patient population as this number could significantly balloon in our community practice.
Right, Rahul, I couldn't agree more. Though talking about similar study, which was not part of AACR, but this was presented recently, part of monthly ASCO plenary session. We saw a similar study, which was NeoTorch with improved PAT-CR and event-free survival that had similar design to AEGEAN, though in NeoTorch, the immunotherapy partner was toripalimab. Even in this study, about 20% patient population did not make it to surgery after being started on systemic therapy. And before we move on to our next study, it is also important to mention that in AEGEAN study, we saw patients that received cisplatin had better EFS when compared to carboplatin. And again, this debate continues to go on when compared to other malignancies as well.
Absolutely. Perfect. We can now move on to our next study. Keynote 966, which was a phase 3 trial in patients with unresectable locally advanced or metastatic extrahepatic or intrahepatic cholangiocarcinoma or gallbladder cancers. And this again is in first line. Our current standard of care for these patients since the approval in September 2022 based off TOPAZ-1 study has been durvalumab with Gemcis. In Keynote 966, the authors evaluate the role of pembrolizumab when combined with Gemcis, and just over 1,000 patients were enrolled in this study. In terms of the design, it is also important to point out that in this study, gemcitabine maintenance In both arms was allowed, whereas in Topaz 1, we saw that the patients only got total of 8 cycles of chemotherapy. Rohit, can you walk us through the study findings here?
Certainly. The primary endpoint here was overall survival, which is extremely important. And secondary endpoints were progression-free survival, overall response rate, and duration of response. In this study, we see marginal OS benefit with 12.7 months in pembro arm versus 10.9 months in placebo arm with a hazard ratio of 0.83. Overall response rate was similar in both arms with 29% in pembro arm versus 28% in placebo arm, and complete response again, very similar, 3% in pembro arm versus 2% in placebo arm. This is not a home run by any means, but this is a devastating disease, and any improvement is welcomed. This will give us another treatment option, but we are not seeing a paradigm shift here. And we all as a community acknowledge that. All right, now focusing our attention into our last but not least study. This study is in fact a very encouraging one in a rare desmoplastic melanoma disease. In terms of prevalence, some studies in fact report about 4% of total cutaneous melanomas are desmoplastic melanoma. So here in SWOG S1512 study, looking at the patients with unresectable desmoplastic melanoma and utilizing single-agent pembrolizumab, this is one of those diseases which carries a very high tumor mutational burden, perhaps due to extensive sun exposure. Rahul, can you walk us through these study findings?
Absolutely. Well, first off, to me, this is the famous Chalabi plot version 2.0. Though it was a small study, 24 out of 27 patients had an overall response and 9 had complete response. Coming back to the TMB story, we know that pembrolizumab has a blanket approval for patients with high TMB over 10, if they've exhausted all their treatment options. But we all know, we see these patients in our clinic, that they don't all have a very robust response. However, the TMB rate in desmoplastic melanoma is literally off the chart. It was way higher than what you see even in diseases including MMR deficient patients. But one thing to emphasize is, yes, desmoplastic melanoma is rare, but having the right diagnosis is very important.
Oh, I completely agree. As these patients do not need dual checkpoint inhibitors upfront, they are actually fine with just single checkpoint inhibitor, in this case, pembrolizumab. To summarize, AEGEAN and NeoTORCH studies continue to confirm benefit from chemoimmunotherapy in neoadjuvant setting for our resectable non-small cell lung cancer patients. But long-term data is extremely important, and we are waiting on that. Keynote 966 study, data appears to be similar to what we've seen with Topaz 1 for our cholangiocarcinoma, but we have ways to go for this particular disease. And then pembrolizumab alone should be sufficient and has, in fact, great results when it comes to desmoplastic melanoma. Thank you for joining us today, and stay tuned for more practice-changing discussions with Oncology Brothers.